Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We'd greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable. Do you need a break from studying? Check out the Dr. Raj podcast, where he discusses topics such as wine with Jesse Katz, sarcoidosis with Bob Saget, Saving the Bees with Sydney S. Sill, and so much more. The podcast also features guest host Becca Spar, who focuses on leadership and connection, as well as Dr. Michelle Kulai and her Everyday Rooms segment, where she talks to patients to share their stories and the challenges that come with different conditions. Just search for the Dr. Raj podcast wherever you're listening now and tune in for a variety of great guests and topics.
This is Dr. Ted O'Connell with the MedPrep2Go Step 2 Qbank podcast. Today we'll be reviewing 3 renal questions. Just a reminder that you can find these questions and many more at medprep2go.com. If you have feedback or you'd like to get involved in this project, please email me at ted.medprep2go@gmail.com. And if you like what we're doing, please let your friends know and consider giving us a review and subscribing to this podcast. All right, let's get started with the first question. A 10-year-old boy is brought to the clinic by his parents due to swelling around his eyes and decreased urine output over the past week. He recently recovered from a sore throat 2 weeks ago. Past medical history is otherwise negative, and he does not take any medications. Vital signs are temperature 98.6 degrees Fahrenheit or 37.0 degrees Celsius. Blood pressure is 150 over 90 millimeters of mercury, pulse 90 beats per minute, and respirations 18 per minute. On physical examination, he has periorbital edema and no other abnormalities. No rashes noted. Laboratory results show a blood urea nitrogen, BUN, level of 40 milligrams per deciliter and a serum creatinine level of 2.0 milligrams per deciliter. Urinalysis reveals hematuria and proteinuria. Which of the following is the most likely diagnosis? A. Acute tubular necrosis. B. IgA nephropathy. C. Minimal change disease. D. Nephritic syndrome. Or E. Nephrotic syndrome. The correct answer is D. Nephritic syndrome. This patient presents with edema, oliguria, hypertension, elevated BUN and creatinine, hematuria, and proteinuria following a sore throat. Nephritic syndrome is characterized by oliguria, azotemia, that is, a rising BUN and creatinine, hematuria, and hypertension. Proteinuria is variable in quantity, and nephrotic range proteinuria is uncommon. The classic cause is post-streptococcal glomerulonephritis, which is suggested in this case by the recent history of a sore throat. Answer choice A, acute tubular necrosis, is incorrect. Acute tubular necrosis typically presents with muddy brown granular casts in the urine and a high fractional excretion of sodium, or FeNA, which are not described here. Answer choice B, IgA nephropathy, is incorrect. IgA nephropathy often presents with recurrent episodes of hematuria, typically following mucosal infections, but it does not usually present with the combination of oliguria, azotemia, and hypertension seen in nephritic syndrome. Answer choice C, minimal change disease, is incorrect. Minimal change disease is a common cause of nephrotic syndrome in children, characterized by massive proteinuria, hypoalbuminemia, and edema, which is not the triad seen in this case. Answer choice E, nephrotic syndrome, is incorrect. Nephrotic syndrome is characterized by massive proteinuria, greater than 3.5 grams per day, hypoalbuminemia, and generalized edema, which are not present in this patient. The key learning point here, nephritic syndrome is characterized by oliguria, azotemia, hematuria, and hypertension. Proteinuria may be seen on urinalysis, though it typically is not in the nephrotic range. The classic cause is post-streptococcal glomerulonephritis. Question 2. A 55-year-old man with a history of chronic kidney disease presents to the emergency department with shortness of breath and swelling in his legs for the past 3 days. He has missed his last 2 dialysis sessions. Vital signs are temperature 98.7 degrees Fahrenheit or 37.0 degrees Celsius, blood pressure 148 over 92 millimeters of mercury, pulse 93 beats per minute, and respirations 22 per minute. On physical examination, he has pitting edema up to his knees, tachycardia, and crackles heard on lung auscultation. Laboratory results show a potassium level of 7.0 milliequivalents per liter, a blood pH of 7.1, and elevated blood urea nitrogen and creatinine levels. Which of the following is the most appropriate next step in the management of this patient? A. Administer intravenous diuretics. B. Initiate emergency dialysis. C. Monitor and recheck labs in 24 hours. D. Prescribe oral potassium binders. Or E. Start bicarbonate therapy. The correct answer is B. Initiate emergency dialysis. The indications for dialysis in a patient with renal failure can be remembered by the AEIOU mnemonic, where A is acidosis, that is, severe metabolic acidosis, typically with a pH less than 7.2. E is for electrolytes, that is, hyperkalemia with a potassium level above 6.5 milliequivalents per liter. I is for ingestion, that is, ingestion of a dialyzable drug or toxin. O is for overload, which is fluid overload. And U is uremia, that is, symptoms of uremia such as pericarditis, encephalopathy, or severe nausea and vomiting. This patient presents with severe hyperkalemia with a potassium level of 7.0 milliequivalents per liter, severe metabolic acidosis with a pH of 7.1, and fluid overload, all of which are indications for emergency dialysis. Answer choice A, administer intravenous diuretics, is incorrect. While diuretics may help with fluid overload, they are not sufficient to address the severe hyperkalemia and acidosis in this patient. Answer choice C, monitor and recheck labs in 24 hours, is incorrect. This approach is inappropriate given the severity of the patient's condition, which requires immediate intervention. Answer choice D, prescribe oral potassium binders, is incorrect. Oral potassium binders may help lower potassium levels, but are not appropriate for immediate management of severe hyperkalemia. Answer choice E, start bicarbonate therapy, is incorrect. Bicarbonate therapy may help with acidosis, but is not sufficient to address the severe hyperkalemia and fluid overload. The key learning point here: indications for dialysis in a patient with renal failure can be remembered by the AEIOU mnemonic. Acidosis, which is severe metabolic acidosis, typically with a pH less than 7.2. Electrolytes, for hyperkalemia with a potassium level above 6.5 milliequivalents per liter. Ingestion of a dialyzable drug or toxin. Overload, that is, fluid overload, and uremia. Question 3. A 6-year-old boy is brought to the clinic by his parents due to swelling around his eyes and legs. The parents report that the swelling has been progressively worsening over the past week. He has otherwise been well with no recent illnesses. Past medical history is negative, and he does not take any medications. Vital signs are within normal limits. On physical examination, the child has periorbital edema and pitting edema in his lower extremities. Laboratory results show a normal complete blood count, normal blood urea nitrogen of 9 milligrams per deciliter, serum creatinine of 0.6 milligrams per deciliter, serum albumin level 2.0 grams per deciliter, and a total cholesterol level of 300 milligrams per deciliter. Urinalysis reveals proteinuria with a protein excretion of 4.0 grams per day. Which of the following is the most likely diagnosis? A, acute glomerulonephritis, B, IgA nephropathy, C, minimal change disease, D, nephritic syndrome, or E, post-streptococcal glomerulonephritis. The correct answer is C, minimal change disease. This patient presents with edema, normal renal function, hypoalbuminemia, hyperlipidemia, and nephrotic range proteinuria. Nephrotic syndrome is characterized by proteinuria above 3.5 grams per day, hypoalbuminemia, edema, and hyperlipidemia. In children, the most common cause is minimal change disease, in which podocytes with missing feet are seen on electron microscopy. Answer choice A, acute glomerulonephritis, is incorrect. Acute glomerulonephritis typically presents with hematuria, hypertension, and oliguria, not with massive proteinuria and hypoalbuminemia. Answer choice B, IgA nephropathy, is incorrect. IgA nephropathy often presents with recurrent episodes of hematuria, typically following mucosal infections. Fewer than 10% of patients present with nephrotic syndrome. Answer choice D, nephritic syndrome, is incorrect. Nephritic syndrome is characterized by hematuria, oliguria, azotemia, and hypertension, not by the massive proteinuria and hypoalbuminemia seen in nephrotic syndrome. Answer choice E, post-streptococcal glomerulonephritis, is incorrect. Post-streptococcal glomerulonephritis, or PSGN, typically presents with hematuria, hypertension, and edema following a streptococcal infection, but does not usually present with massive proteinuria and hypoalbuminemia. This patient has not had any recent illnesses to suggest PSGN. The key learning point here: nephrotic syndrome is characterized by proteinuria greater than 3.5 grams per day, hypoalbuminemia, edema, and hyperlipidemia. In children, the most common cause is minimal change disease, in which podocytes with missing feet are seen on electron microscopy. All right, that's it for this episode, but please do check out our other episodes as well as all of the content available online at medprep2go.com.
Well, the holidays have come and gone once again, but if you've forgotten to get that special someone in your life a gift, well, Mint Mobile is extending their holiday offer of half off unlimited wireless. So here's the idea. You get it now, you call it an early present for next year. What do you have to lose? Give it a try at mintmobile.com/switch.
Limited time 50% off regular price for new customers. Upfront payment required. $45 for 3 months, $90 for 6 months, or $180 for 12-month plan. Taxes and fees extra. Speeds may slow after 50 gigabytes per month when network is busy. See terms.
Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 2 Bundle podcast, which gets you all of the Step 2 secrets and our Step 2 questions podcast combined and ad-free. You'll also get early access to all of our Step 2 questions episodes before they're released public. The bundled podcast is available now, and you can save over 40% with an annual plan. Details at medprep2go.com.